Lead is one of the oldest occupational health hazards. Lead can stay in your body for years and can cause serious health effects that may not be treatable. Overexposure to lead is still a major problem among workers in many industries. No level of lead in the air is completely safe. Lead can be in the air in your home. If lead-based paint has been used, it's used in some types of dishes and china and can be even found in the water we drink, since lead solder was used in many types of plumbing. It can be almost anywhere, and public health experts strongly recommend that all workers handling lead periodically monitor their blood levels and most certainly adhere to safe work practices established by their employers. In the workplace, the metal that is used to make castings contains a certain percentage of lead, depending upon the type of metal being processed. The lead content is between 5 and 7% of different metals. As the metal is melted, a potential for exposure to lead fumes may occur. When the melted metal is poured into molds, another exposure potential may occur. Since the melted metal has a small percentage of lead in it, as it comes into contact with the molding sand in the mold, the sand then is also exposed to lead. As castings are shaken off, cut off, and ground, exposure to lead dust and particles contained in the brass casting or other type of casting is also a potential for possible lead exposure. Let's quickly review some health damage that lead can cause. Lead slowly builds up in your body. The more lead, the more likely it is that harm may occur. Large amounts can severely damage your brain, nervous system, kidneys, or blood. You may notice tiredness, trouble concentrating, headaches, irritability, stomach pains, poor appetite, constipation, diarrhea, muscle or joint pains, and weakness. Damage may be occurring even if you have no symptoms. Each person is different and responds differently to varying degrees of lead poisoning. Okay, let's talk about protecting yourself from lead exposure in the workplace. Obviously, the best way to prevent lead or any toxic substance from causing harm is to minimize or prevent exposure. This comes in many forms. Ventilation. For many jobs, local exhaust ventilation can be used to control exposures. Local exhaust systems capture contaminated air from the source before it spreads into your breathing zone. Other types of ventilation are not nearly as effective in controlling lead exposures, and these include fans, open windows, and doors. Personal protective equipment. The proper use of respirators and work uniforms can be very important for protecting your health. Lead from the workplace can be tracked everywhere, in your car, home, and other places. After showering at work, never wear your work clothing and shoes outside the workplace. Of course, wash your hands and arms before you eat or before you handle your food or cigarettes. Never store food or eat in the work areas. Part of your responsibility is to participate in the required company medical program. Physical exams and blood tests are intended to detect early signs of overexposure to lead before you get sick. Another important part of protecting your health is to use the proper equipment for cleaning floors, walls, and other surfaces. A special vacuum or wet mop should be used to remove lead dust from surfaces. The vacuum must be fitted with an HEPA or high-efficiency particulate accumulator. An HEPA filter collects very fine lead dust particles. This fine dust is easy to breathe into your lungs, and a vacuum without this HEPA filter will just recycle the dust back into the workroom air through the exhaust system. Keep in mind the dust collected is a hazardous material and must be treated as such. Above all, before you eat, drink, or smoke, be sure to wash your hands, arms, and face to keep any lead from being ingested. To advise you of what safety standards are required in a lead environment, let's review some basic safety requirements and responsibilities. First of all, there are regulations regarding the amount of lead in the workplace air, measured over an 8-hour period of time. If these levels are exceeded, your employer must set up an air monitoring program to determine the typical daily exposure level for each job classification in each work area on each shift. Employers must notify their employees in writing of the results of this monitoring, which reflects their exposure. Employers must repeat air monitoring at least every 6 months, and notify workers in writing of these results. If workers are exposed at or above a certain level for more than 30 days each year, the employer must establish a medical surveillance program. There are PELs, or permissible exposure limits, which means that exposures above a certain level part of the time and under certain levels part of the time, but they average out to be a safe level over an 8-hour work shift. Employers are required to control air-lead levels so that each worker's exposure does not average more than the permissible exposure limit over any workday. If monitoring determines that these air levels are greater than the permissible exposure limit, employers must monitor every 3 months. Let's take a minute to help you understand a blood lead test. Generally, a blood lead test reading below 20 means that lead exposure is typical for adults. In children and pregnant women, any amount of lead reading may not be safe. If your reading is between 40 and 20, this means you should probably see a doctor and have blood lead tests every 6 months. Lead hazards in your workplace should be reduced as much as possible. Between 40 and 50 readings, the employer must arrange for the employee to be checked by a doctor once a year and to get a blood test every 2 months. In this case, the employer must reduce lead hazards in the workplace. A reading between 50 and 60, this is a danger zone, and if your blood lead test stays at an average above a certain level for 6 months or more, the employee must be transferred to a lead-free area until the blood lead level drops to a medically acceptable level. In this case, the employee must be checked by a doctor and have a blood lead test every month. The same thing applies to any reading over 60. A lead exposure prevention program is adopted by any employer whose employees may be working with or exposed to lead. Generally, the first thing that happens before a new employee begins work is to have a medical examination. This may include an audiometric exam or hearing exam, and a spirometry exam, which tests the lungs to make sure you can wear respiratory protective equipment. A blood test will determine if you have any existing lead exposure and will serve as a baseline for future exams. Each company may have different examinations for their specific operations. The next step is training and education. Regardless of where you worked before, or if this is your first job, training is an important part of your job. You'll be trained in the proper use of respiratory protection and how to use respirators. You'll also learn how to fit test your respirator to make sure your respirator fits properly and protects your health the way it was intended. You'll receive special training in the proper use, handling, wearing, cleaning, and storing of respirators. Respiratory protection, when required, must be worn and worn properly at all times when you're working in an exposed area. Respiratory protection is for your safety and health, so be sure to follow proper procedures. The cleanliness of the facility plays an important part in lead safety. Air exhaust systems provide some air cleanliness, along with sweeping equipment, plant cleanup, and of course through your efforts on a daily basis by cleaning up spills, you can help maintain a clean and healthy workplace. Employee hygiene is also part of your responsibility. Clean uniforms are generally provided in lead operations, so these uniforms can be properly cleaned by an industrial service, knowledgeable about lead, and therefore can take appropriate precautions for their employees. Be sure to keep uniform closets clean and dirty uniforms in their proper bins. Washing your hands and face before eating or smoking is very important to prevent lead from being ingested into your body. About smoking. Smoking can accelerate induction of chemicals into your body and bloodstream up to 90% faster than if you don't smoke. Anyone who smokes should take specific precautions to never smoke around any chemicals, lead, or other types of hazardous materials. As you've already been told, medical tests are an important part of keeping you healthy. The results of your medical tests are confidential and they're maintained for a minimum of 40 years. You have the right to see the results of any medical examination results. Over the years, it's been determined that workers who comply with company policies, procedures, and appropriate medical exams take their job responsibilities seriously and have a good attitude about safety and won't have any problems in the workplace environment. There have been many instances where employees are exposed to lead while off the job, performing off-duty work such as sanding and painting automobiles, using lead-based house paint, drinking water from lead pipes, breathing gasoline vapors which contain lead, and using plates or imported stoneware dishes which contain lead. What we're trying to say is safety is a 24-hour-a-day habit. At work, you have a number of controls such as ventilation, housekeeping, respiratory protection, and others. But off the job, many people forget that hazards can be found almost anywhere. It's up to you to use your good judgment and think safety while on and off the job. Remember that lead slowly builds up in your body. The more lead, the more likely it is that harm may occur. Lead dust from your job can be taken home on your work shoes, clothing, skin, and hair. The proper use of respirators and work clothing can be very important for protecting your health. Without the use of an HEPA filter on a lead dust vacuum cleaner, the lead dust can be recycled back into the work area through the exhaust system. The dust collected by a vacuum cleaner is hazardous material and must be treated as such. Above all, before you eat, drink, or smoke, be sure to wash your hands, arms, and face to keep any lead from being ingested. There are other rules. However, it's up to you to fully understand and follow your company's policies and procedures. Taking shortcuts, working in an unsafe manner, or disregarding safety rules is generally the cause of most workplace injuries. If you take the responsibility for safety, think safety on every job you perform, it's difficult to have an accident. It's really that simple. If you have any questions or you're not sure about something, ask your supervisor. Make sure you know what to do, how to do it safely, and then use your good judgment to make your workplace a safe and healthful place in which to work.